Hello there, Ugandans, especially my colleagues in uniform. When I talk about my colleagues in uniform, I'm meaning the health workers. James William Mugeni is my name. I'm a medical clinic officer by profession, Ugandan trained, and I'm a certified public manager trained by the US consortium of public managers. Ugandans, today I watched a video where the chairman Human Rights Commission, Nagadia, saying most reports, most claims and most reports made at the Human Rights Commissions have been technically dismissed on fake medical grounds. Fake medical grounds. I am speaking about this following about, I think, a week of a series of attacks. What I would call attacks by the Permanent Secretary, Minister of Health, to the medical profession. A few days ago he said we clinical officers are a liability. The other day he was confronting, I saw her confront a group of health workers who looked like you see antelopes when they have when a lion picks one of them, they stay standing and they have nothing to say. As a medic who has seen it all, I've seen it all. I was in Uganda when medicine counted. I worked with Uganda prisons when medicine counted. Amongst the people I'm proud of and I normally speak about is Moses Ali. When I, a clinical officer, could make a referral and is respected across, because this is a clinical officer, definitely you refer to high authority or higher practice. I go to Luzira prisons and recommend Moses Ali, and Moses Ali is released. Nowadays I'm seeing doctors of all kinds trying to make recommendations for the treatment of the Wagos on medical grounds, and they are denied. Nagadi has just said here that most reports, most medical recommendations are technically fraudulent. Forged medical reports. Really? Could we say these medical reports are made by clinical officers? It's there online. And the medical people are quiet. This thing affects us globally. Good enough, I think I have come to the end of my medical practice, which I didn't enjoy. But I feel I want to lend medicine a hand. I didn't enjoy at all. When I had just qualified, there was a ban on recruitment, so there was no recruitment. Stayed for over 10 years without practicing. Right now, I'm seeing my colleagues who will never practice medicine at all. They will not have an opportunity. And Diana, the permanent secretary, goes to say clinical liability. Doctors can't practice, clinical officers can't practice, nurses can't practice. And this can only be confronted by us, people in uniform. I have reached a level where now I need medical attention, but I want to see that medicine revived. And I would like colleagues to join me. My colleagues are cowards. Diana comes and talks about clinical officers and nobody comes up to defend. You are tarnished globally. Nowadays, information reaches every part of the sphere. You colleagues of mine were sharing, you shared with me what Diana said about us. And I don't see anyone apart from myself, who has almost consulted globally. I want colleagues who are ready to confront the situation and change medicine in Uganda to speak with me, to come up with me. And for me, I have promised leadership in that country. I helped fix leadership in the USA. I helped fix leadership in the USA. President Donald Trump, I was on your team. I know where your office is here. I knocked doors for you. And the purpose why I knocked doors for you was that you visit the foreign policy with my country. Everything in my country is upside down. Even your own team, the US team in Uganda, is not helping us at all. They are part of the rot we are seeing at home. So colleagues in uniform, the medics, nobody is going to change the situation. It's so sad. I am in the US where there's severe lack of health workers. It's severe. And yet we can't even practice medicine globally. I came here, I couldn't practice medicine. Doctors followed me here. So many doctors who ended up washing dishes, who ended up in McDonald's, who ended up in post office. These are things we should be tackling professionally, and nobody has confronted this. I'm like, the US is in need of manpower, severe need. Where do we even send? I wrote even an article in New Vision. Where do we send people to the Arab world? The US here needs workers. Forget about their politics. These people are suffering more than we're suffering in our countries. When it comes to healthcare, the industry is blank. I can't even access healthcare here due to lack of manpower, severe lack of manpower. And this is a global issue that we can't tackle. So colleagues in uniform, I'm not going to sit down. At least right now I'm free. Those days you do fear, I was punished for every statement I made. Whenever I spoke, I was punished. But I don't have any uniform anymore. I'm a cheerio. I eat from the streets. But I'm ready to correct medicine at home. Thank you for listening to me. James William Mugeni, a clinic officer, speaking.